I'm Dr. Shabani, back again. All right, so today we're going to talk a little bit about Botox and how it works and what it does. So first things first, I want to show you the muscles of facial expression. So when we do Botox, of course, one of the goals is to treat fine lines and wrinkles. But to me, personally, the best thing about Botox is the brow lift that it gives you. So I want to go over the muscles of facial expression. Right here we have the procerus, and if you look, like where you would see your 11s, like kind of here and here, are your corrugators, okay? So all of those muscles, those three muscles work together, and when they contract, they form our 11s. And if you have one muscle particularly stronger than the other, some people will actually just have, instead of two lines for their 11s, they'll get a single line for their 11. So when we inject Botox, what we really want to do is relax those muscles. And what does that do? Well, here you can see the fibers of the procerus and the corrugators insert into this large piece of real estate called the frontalis muscle. So when we furrow our brow, like when one of our kids spills Kool-Aid on a white rug, we contract these muscles, and over time we develop what's called the 11s. But it's caused by the dynamic motion of the procerus and corrugators working together and contracting. And they just gently pull down on the frontalis, because as you can see, the muscles insert right into the frontalis up here. So when we inject these muscles, there's typically 5 injection points. And by injecting those 5 injection points, what it does is creates a brow lift for the patient. For me, personally, I think that the brow lift is the absolute best part of Botox. Now, this larger piece of real estate where we see our wrinkles up here on our forehead, that's called the frontalis. The key with having your frontalis injected is that you want to balance what was injected in your brow. So while you get a brow lift from injecting these 3 muscles, when we inject the frontalis up here, it mitigates or decreases our brow lift. So the key to injecting Botox is to have a balanced injection of the brow and the frontalis so that you look elegantly relaxed but not plastic. So patients who look plastic are pretty much patients who have a bunch of Botox injected into their frontalis, a lesser amount, or possibly even no Botox injected into their brow. So what happens is the frontalis freezes and we really don't get much of a brow lift. And it's not something that you'll consciously appreciate, but you may look at an individual, say at the grocery store, and see that they look kind of different or odd, and sometimes it can be because of this imbalance. So that's the beginning of our primer on Botox. We will talk more. Thank you for tuning in.